We actually just had a discussion with Dr. Pyle Coley from Colorado about some of the measles cases that we're seeing both in North and South Carolina, I believe a case in each state. Talking to her a little bit about what folks should be aware of if they aren't vaccinated or maybe if they are vaccinated, including what symptoms you should be looking out for and when you need to go to a hospital when you start to see some of those symptoms. All good information as we start to see some of these cases rise.
Dr. Coley, if I can get you just to say your first and last name for us and your title.
Dr. Pyle Coley, Payalkohli, and I guess you can call me the WCNC medical expert, because like usually the KUSA medical or 9 News.
Yeah, perfect. We'll use you as our expert if you're fine with that. And then I know you're highly regarded. You speak many times. Your background as a cardiologist, but I know you're also an MD.
Yes, I'm an internist and cardiologist.
Okay, perfect.
Internal medicine as well.
Okay, I'll add that for sure. So let's talk about the measles.
I'm sorry, since you're in North Carolina, I'm a professor at Duke as well, Duke University and Johns Hopkins University too.
Wow.
So if you want, I can send you my full title, but I don't know if you want to allude to that just because you guys are in North Carolina.
Yeah, I definitely will. That'd be great. Great.
So I'll send it to you right after we're done here.
Perfect. Awesome. So let's jump in. The measles, we have, I think, one case in North Carolina, one case in South Carolina right now. So a lot of the questioning that folks are asking us is, should they be worried? And I know a lot of times those are vaccinated. There are some cases sometimes that people still get the measles, but it seems like the big discussion here is about getting vaccinated and really watching where this disease is spreading, right? Can I start there?
For sure. So as a physician, I have never actually seen a case of measles because it was eradicated in the United States in the year 2000. But now, obviously, given the findings of the last year, we're starting as physicians to become reacclimated with the disease. And essentially, measles is really high risk for unvaccinated individuals. But it's really important to know that you have proof of vaccination and know that you got the right type of vaccine. Because now that measles is all around us, it's one of the most contagious illnesses in medicine. In fact, arguably the most contagious illness in medicine. So it's really important because it spreads so efficiently to make sure that you're protected by having your vaccination status checked or renewed if you haven't had a vaccine recently.
And I don't want to be a fear monger here, but it is a dangerous disease too. Can we talk about that?
Measles can be very dangerous for a number of reasons. One, because I talked about just how contagious it is. So an average person that gets measles spreads it to about 12 to 16 other people. So very good exponential growth there. It also can linger in the air for up to 2 hours. You don't even have to come into direct contact with somebody. It's an airborne disease that can linger in the air and cause infection. And about 1 in 10 to 1 in 20 people, especially kids, immunocompromised and pregnant patients, will get life-threatening complications. You're talking about brain swelling like encephalitis, deafness, blindness, seizures. And for a lot of people that recover from measles, it can even cause consequences afterwards. So it wipes out your immune system, so you become more prone to other infections. And many years after the measles, you can actually have something called subacute sclerosing panencephalitis, which is a brain fibrosing condition where you get scarring in the brain as a result of that measles. So it's not just a rash, it's not just a cold, it's actually a pretty significant illness, which is why prevention is key because we have a highly effective vaccine.
Let's talk about vaccines really quickly. I've heard MMRV vaccine sometimes recommended. MMR vaccine might be recommended. Dispel any myths between the two, and what might the chosen vaccine be for those physicians that people see?
So most adults will get the MMR vaccine, measles, mumps, and rubella, and that's usually given at 2 doses around age 1 and then around age 4 to 6. And if you get 1 dose, it's 93% effective. If you get 2 doses, it's 97% effective, and it essentially offers lifelong immunity. So once you get the vaccine, you can be sort of done with thinking about your immunity. Alternatively, if you're born before 1956, because measles was endemic here in the United States, you probably have natural immunity. So the people that need to be concerned are the ones that are born after 1956 and don't have documentation of the MMR. Now, in the 1960s in the United States, they were using a different vaccine, a different measles vaccine that's not as effective. So make sure you look back in your records and check whether you got at least 2 doses of that MMR. And if not, as an adult, you can go get an additional dose. In fact, additional doses are recommended now that there's so much measles around us for people who are high risk for exposure, like college students, like healthcare workers, people who work in hospitals that have cases with measles and such. That's the MMR vaccine. The MMRV is measles, mumps, rubella with varicella, which is the chickenpox vaccine. That's usually given to the kids, but the first time you get the MMRV, it puts you at higher risk for having a seizure because now you've got too much immune activation going on. So usually pediatricians recommend MMR separate from the V for the first dose for kids. And then when they're getting that second shot between age 4 and 6, they can actually get that MMRV. Most adults have already had varicella or chickenpox, or they've already been vaccinated, so they probably wouldn't get that MMRV.
Okay, great stuff to know. So I have a 7-month-old, right? She has not been vaccinated yet with the MMR vaccine. And obviously with the cases that we're seeing, or a case, we have talked to our physicians about what should we do, right? So what would be in your best interest or in your best advice for folks that are in my type of predicament where they have a young child who's around that 1-year-old age? What should we be doing?
So, if they're 1 year old, they can go ahead and get that first dose because that's at 12 to 14 months. But if they're in that window of the 6 months to 12 months where they're a little too young to get it, this is the decision tree. So if you're taking them to an area or you're traveling or there might have been an exposure or what have you, then it's probably okay to give it to them a little early. The reason that we don't want to give it too early is because number one, the immune system is not mature. So it's not going to react normally to the vaccine itself. And number two, that compromises both the efficacy and the safety of the vaccine. So in that 6 to 12 month window, it's really a personalized decision with your pediatrician. If you're traveling, you think you might have a child who's exposed, or you live in an area where there have been documented measles cases, you may want to go ahead and pull the trigger. But that doesn't mean you're not going to get that 1 year one. So if you give it to them early, make sure that they still get that MMR dose at 1 year, because you're essentially just giving them one extra dose. It's not necessarily starting their cycle a little bit early.
Okay, great advice there. So in the event that someone, either is around someone with measles or may think that they have been around somebody with measles, what should they do? And when would be the time to go to a hospital if they start to see some symptoms?
Yeah, so this is really key information that every one of us needs to know now that measles is here in our state. So the first thing is, if you think you've been exposed to someone, you sit down and say, do I have immunity? And that means, have I received at least 2 doses of that MMR vaccine? Or do I have a blood test, which is called a titer, an antibody test, that you can actually get checked at the lab that tells you how many antibodies you have against measles, mumps, and rubella. So I actually had mine checked recently because I'm a healthcare worker. Mine were low, so I ended up getting an additional dose of the MMR vaccine. So either a blood test confirming immunity, or you've had measles before, or you've had 2 doses of the MMR. If that's the case, you just need to monitor for symptoms for the next 21 days, and we can talk about that, what that would look like. If you are not sure that you've had 2 doses of the MMR or you're immune, then it's really important to call your doctor right away, because within those first few days of exposure, they would probably give you a dose of the MMR vaccine to protect you. And if you're a young baby, immunocompromised or pregnant, they may even give you something called IVIG, which are antibodies against the measles virus that they would inject into you so that you can actually sop up the virus and prevent the infection before it happens. That's called post-exposure prophylaxis. So after you get exposed, you prevent the virus from sort of taking hold. That has to happen within the first few days in order for it to be effective. So really important to call your doctor right away. If you do develop signs of measles, you'll usually see symptoms within 1 to 2 weeks following exposure, but it can go out up to 3 weeks. And you'll get the 3 C's. So cough, you get a cough, conjunctivitis, a red eye, and coryza, which is a fancy way of saying runny nose. And those are the 3 C's. So it feels like a head cold almost. You have a cough, you have a runny nose, you have red eyes. What's different is a few days into your illness, you'll start to have some spots in your mouth. Those are called Koplik spots. And then a couple of days after that, you'll start to develop a rash, which is very classic for measles. It starts up near your hairline and kind of goes downwards, involving your trunk and your arms and your legs. So if you start to develop those Koplik spots and rash, it's pretty clear you have measles. You want to isolate, not go to work, not go to daycare, because again, it's a very infectious illness. Stay away from anyone who's immunocompromised or pregnant. If you start to have severe symptoms like a very high fever, extreme nausea, vomiting, inability to keep any food down, or you have any kind of confusion or lethargy, or you end up having a seizure, these are all signs you need to go to the emergency room right away. Now, some groups are very high risk, like kids under 1, immunocompromised immunocompromised patients and pregnant patients. So I would say if you're one of those groups, you want to contact your doctor right away. Before you go to any emergency room, it's really, really important to call ahead, because the last thing you want to do is show up in a waiting room full of people with an active case of measles, because again, it's so highly infectious.
Perfect. Last thing, and I'll ask you if I missed anything, but we have gotten some emails about how this could affect Medicaid, and I have no idea because I'm not an expert, but have there been any murmurs? I know that this big, beautiful bill just got passed last week, but does that, to you, seem to draw any type of challenges or any road bumps in the future ahead to try and get people vaccinated?
I would say as Medicaid funding gets cut, it's going to affect hospitals and infrastructures, especially for low-income people, which are higher risk, obviously, depending on where they've traveled to and such for getting measles. So I think it may put us at risk for containing pandemics. It may also put us at risk for not having effective prevention and vaccination strategies, because people may think, well, if they're uninsured, they can't get a vaccine. Now, I'm hoping that the state health programs, the Department of Public Health of each state, steps up and offers free vaccination clinics. I know we do here in Colorado. We have a free vaccination clinic for the MMR vaccine. So hopefully that won't be a barrier, but it's really important. If somebody loses Medicaid, they don't have good access to healthcare system, to the resources, to the education. They may not, A, know about prevention, B, know about treatment, and C, they may end up not seeking care and actually spreading the virus more effectively because they're not, within an institution. So I have concerns that this is not the best time, given that we're at the highest number of measles cases the United States has ever seen, to cut off resources. But having said that, I'm hoping that the public health departments do continue the educational campaigns to try to raise awareness of prevention and treatment strategies.
Well said. Dr. Coley, what else have I missed that maybe comes to mind for you to let our viewership know?
Having a vaccine that's 97% effective and a disease that's so highly contagious in 2025, no one should be getting measles. And the fact that it's come here has really been a combination of dropping rates of vaccine. People aren't getting vaccinated. And in order to get herd immunity, which means you're part of a group that is vaccinated, so you're protected just by being part of a vaccinated group, 95% of people have to be vaccinated against the measles. And we've seen rates now in schools and daycares and such going down into the low 90s, which is why the virus has got on a plane and come here, because it's endemic in other parts of the world. And we travel all over the world in the United States here. And so it's really gotten on a plane and come here. So I'm hoping that with more education, more vaccination, we can try to contain these outbreaks and go back to that stage where the virus was eradicated, because it's a very serious illness that is highly preventable. So I would encourage every single person to get their blood test checked and check if they have the titers, if they don't know what their vaccination history is, or if they're high risk for exposure, traveling somewhere where there's measles outbreaks right now, that they go ahead and get another dose of that MMR vaccine.
Awesome. Dr. Coley, thank you. Let me stop this recording.
All right, so great to have Dr. Coley. We will actually be having her every Friday at around 7 o'clock to discuss that day's or that week's health topics, to get you the latest information, everything that you should know from that expert.